Just a small reminder, Cara, about the recording.
Yes, thank you, Marika. I will be sure to mention. And yeah, I think in the interest of not going too much over time, we should probably get started. I'm sure there's a lot of colleagues who will still be joining us and who are still now engaged in the previous sessions in the European Public Health Week. So I think we'll be growing as we go along, but let's already kick off this session. Hello and a late good morning to all of you who are already here and joining us on this last day of the European Public Health Week 2022. I do believe most of you already in the room know me, but for those who might not, my name is Cara Pries. It's my pleasure to welcome you to this webinar today on behalf of the Austrian National Public Health Institute, the GÖK, and on behalf of the Austrian team working on FIRI, the European Population Health Information Research Infrastructure Project. We will hear a little bit more about FIRI's activities in a moment from a colleague, Nienke, who is among the coordinating team of the project. And from our side here at GÖK and FIRI, we lead a work package called the Rapid Exchange Forum, focused on bringing together experts, decision makers, advisors from many different countries for regular bi-weekly exchanges on information on burning policy and research questions that have come up over the last 2 years in the course of the COVID-19 pandemic. And in the spirit of the Rapid Exchange Forum, today, together with all of you, with experts from the FIRI network and colleagues from side of ECDC, we want to take the chance to look not only at acute questions of the moment, but to look to the future, to medium and long-term future, and ask what does the future hold for preparedness in Europe as a whole. And of course, in that context, we want to talk about COVID, the need to adapt strategies to the coming autumn and winter season, and perhaps also, if we're being a bit optimistic, adapt strategies to a phase where we might be transitioning out of the very acute phase of the pandemic going forward. But beyond that, beyond COVID, we also want to look at European preparedness as a whole and what the future holds for all our next upcoming potential challenges. Just right now, for example, I'm sure we're all following with maybe a little bit of alarm the rare rise in cases of monkeypox infections that have been seen in Europe and in other parts of the world at the moment and in these last few weeks. So we're very happy today to be hearing from our presenters about the work of European agencies in this space and also about the role of modeling and forecasting in predicting and preparing us for what might lay ahead when it comes to different threats and risks. Just a few very quick housekeeping points before I show you our agenda for today. The presentations today will be recorded by the Scienzano team, and we want to share the presentations given by the speakers later on the FIRI website. We'll also be posting the link to the FIRI website in the chat as we go along. However, we will also have time for discussion at the end of the session, and this discussion portion of the event, the recording will not be shared or posted anywhere. So please, if you would like to participate in the discussion, ask questions, make comments, feel free to do so. And please be assured that the discussion during the event will not be used as a recording later on. I think we can take a look at the agenda. If we could have the next slide, please. As mentioned, first of all, we're very happy to hear from Nienke Schutte from side of Scienzano, the Belgian Public Health Institute. She's part of the project coordination team at FIRI, and she'll tell us a little bit about FIRI's activities in the space of as they relate to preparedness, and also especially FIRI's activities when it comes to health information system assessments in Europe. And building a consolidated health information infrastructure, which is of course vital for preparedness and which FIRI hopes to contribute to. Then we're very happy to hear from colleagues from side of ECDC, who will introduce to us a little bit the really vast work that ECDC is doing in the space of supporting preparedness and response and helping all countries in Europe face current and upcoming threats. And then last but not least, we'll hear from Maria Silva Paulo at UNL, who are also members of the FIRI network and she will tell us a bit about the role of modeling and forecasting to predict and to meet our next challenges. And she will also give us a bit of an outlook on medium-term preparedness in the sense of telling us a bit about the Portuguese example, strategies, and the learnings, especially when it comes to preparing for the coming autumn and winter period. And then, as mentioned, at the end, we will have space for a bit of discussion, and we really hope to have your questions, your input, so please do not be shy. If you have any questions during the presentations for the speakers, please go ahead and put them into the chat, where we will then pick them up during the discussion portion. Or, of course, once we get to the discussion, please feel free to raise your hand and come in live, and we can unmute you to ask your questions or comment. If we can shortly go to the next slide, we also have an overview of all our speakers mentioned, Nienke, Marie, Jonathan, and Maria, and I will introduce them to you as well as we go along to the presentations. And yeah, now without further ado, I'm very happy to give the floor to Nienke Schutte, who is a researcher at Sciensano, the Belgian National Public Health Institute, and crucially who's part of the FIRAI coordination team, and will introduce us to FIRAI activities a bit more deeply, and especially also as they relate to preparedness and to health information systems assessment. So Nienke, the floor is yours.
Thank you so much, Kara. So indeed, I will set the scene a little bit, talking about the population health information research infrastructure, and also a little bit about one part of this big project, that is the health information system assessments that we're doing. So in the past, many European projects have focused on preparing the transition towards sustainable and more integrated EU health information system for both research and for public health and policy. So in this project, it was concluded that there was a really need for a research infrastructure on population health research. So that means a platform with services to facilitate population health research. So in November 2020, FIRAI started, which is short for the Population Health Information Research Infrastructure. This is a real European mechanism that aims to facilitate and support data-driven population health research and the exchange of best practices to support decision-making. Within FIRAI, we have a strong network of 41 partners in 30 European countries. Most of them are national institutes of public health or for research and disease control, but we also have ministries in our network, ministries of health, and universities. So quickly, I would like to take you through the main objectives of FIRAI. FIRAI aims to provide a one-stop shop with fair data catalogs on health and healthcare data and metadata, aiming to provide structured information exchange. And this really facilitates the access and the use of European data for research. And we are also implementing a more of a federated infrastructure. So this allows for analysis to be across borders without moving the data. This is a screenshot of our health information portal that we have been developing. I really hope that one of my colleagues can post the link in the chat so you can take a look where you can find this one-stop shop online. Secondly, we provide structured exchange between countries on COVID-19 best practices and expertise. The Rapid Exchange Forum, where Kara was already referring to, our bi-weekly meeting where we discuss urgent policy and research questions, is a great example. This really allows researchers to provide relevant and evidence-based information that is ready to be used in research, but also in the decision-making processes of policymakers. Finally, to promote interoperability and tackle health information inequalities, FIRAI provides a lot of capacity building exercises to provide support for management of population health data from the beginning, so designing the data collection, analysis, reporting, and preservation. And also an important part here is knowledge translation. So FIRAI is offering many services and is working along many different topics to support researchers in their research and in their methodologies to provide relevant and evidence-based information that is ready to be used. not only by decision makers, but also researchers, clinicians, and citizens. But today I would like to focus on one topic that we are studying within the FIRI project, that is the COVID-19 health information assessments. And I think this really nicely links in with the webinar that was hosted this morning by the Observatory on the transforming health systems for resilience. So talking about access, workforce, and more digital aspects. So health systems are built to improve the health of the population. And when the COVID-19 crisis hit Europe, the sustained performance of these health systems was really challenged. So the resilience of this healthcare system, so I've provided here you with the definition that was made by the Observatory in their report in 2021. So defined as the ability of a health system to absorb, adapt, and transform to cope with different shocks. And all these different health systems in Europe, they were found to be different. And this leaves for some important lessons to be learned, and of course some best practices to be showcased to help other European countries to assess their own health systems and their response to the COVID-19 crisis, and to really strengthen the health systems. So a common denominator in health systems is health information. So that refers to the data and information that is needed to monitor the health of patients, as well as the general population. So the patients of today and the patients of tomorrow. And especially in times of crisis, data should be available in a timely manner. It should be trustworthy. Data and information should be shared across European borders for countries to learn from each other. And data and, of course, indicators should be interoperable for them to be used in research and in the decision-making processes. I think the COVID-19 pandemic really showed that within many European countries, health information systems were not always equipped to accommodate all these new data and information flows that were needed in order for researchers to provide best practices and evidence to underpin policy decisions. So, for example, ad hoc surveillance and monitoring systems were set up, sometimes even under emergency legislation, and a clear governance of health information was lacking. So what about the European health information system landscape? So there are a lot of partners on board. The ECDC we have today also as well. We have Marie and Jonathan who will provide some more information about the role of ECDC in the next presentation. And the ECDC has of course TESI and the EWRS as reporting systems. We have Eurostat. That collects a lot of data on mortality, hospital statistics, etc. We have, of course, the Commission, for example, DG Santé, which provides public health programs, does a lot of coordination with the OECD and WHO, and has presented 2 weeks ago the first legislation for the European health data space. Other big players in the field are, of course, the WHO with their European Health Information Initiative, the OECD, and of course, now the new agency, HERA, the Health Emergency Response Agency, with their unit on Epidemic Intelligence. So what about national health information systems? Well, within our project FIRI, we aim to map the national health information systems, specifically the health information systems that monitor the effects of COVID-19 on population health, and the health information systems that accommodate all these flows of data and information with regards to COVID-19. Because not all national surveillance systems were equipped to accommodate all the flows, and new systems were set up. So we are doing virtual country visits in 10 different countries. That means semi-structured interviews with all the different health information stakeholders in these countries. We use a WHO tool for health information system assessments, which we adapted to accommodate for COVID-19. And this results in a SWOT analysis, so strengths, weaknesses, and opportunities, and some SMART recommendations. SMART stands for specific, measurable, achievable, relevant, and time-bound recommendations for the countries in order to improve their health information system accommodating 19, and of course to create a more sustainable health information system that is resilient and can adapt to shocks such as a pandemic. Finally, we will publish one-pagers describing all the health information systems of these countries that we're going to visit. So as you can see here on the map, we have 10 different countries that we will be visiting, and we have a nice geographical distribution. So what are the scope of the different assessments? Of course, we would like to identify the strengths and weaknesses of the health information system for COVID-19, but also we would like to provide other countries with learning opportunities and thereby contributing to capacity building, hopefully leading to a reduction of health information inequalities between the countries. Of course, these health information system assessments can be used to identify data sources that might have not been fully exploited yet, especially when you think about the wider effects of COVID-19, which goes beyond the direct morbidity and mortality of COVID-19, but more the wider effects on the population. These interviews also create opportunities to engage and exchange with national health information stakeholders and the different authorities. And finally, and this might be the most important thing that we're going to talk about today, we are able to identify key recommendations for resilient health information systems, which can lead to better preparedness for future crises. So this is the tool that we're using. It's a tool from WHO to strengthen health information systems. And we're assessing the health information system across different main topics, such as data collection, analysis, reporting, knowledge translation, governance, and resources. So up until now, we have assessed 4 different countries. So that will be Italy, Portugal, Ireland, and Malta, and 6 or 7 other country visits are planned. And I've listed here some very preliminary findings based on these 4 country visits. So we saw that there were some difficulties with linking data or following a patient through the healthcare system when a unique person identifier is not collected in the health system. We see that many of the data collectors use different person identifiers, which make it very difficult to follow a patient through the system. We also see that there is weak data collection at the community level, and a lot of heterogeneous, mostly ICT systems are used there. We also see that there is a large need for developments in automated processes for data collection and validation. We also see that there is a need of including health information system elements in the pandemic preparedness strategy, and the significance of having an infodemic management in an overarching strategy for the health information system. So when the crisis progressed, numerous initiatives were set up aiming to harmonize all the available health information and to streamline all the health information that was needed to address the COVID-19 crisis, both at a national level, but also at the international level. So, for example, the ECDC saw their mandate extended to strengthen its work in preparedness and response. And I think especially with the focus on developments of digital platforms for epidemiological surveillance. And I think the assessments that we performed in FIRI on the national level will generate key recommendations, and all these initiatives together will lead to more resilient health information systems and really rendering their performance more sustainable for the future. So today, I just gave you a short glimpse about the preliminary results that we have acquired so far. Actually, following this webinar at 1 o'clock, we will present a more in-depth analysis of the preliminary findings at also an event that is part of the European Public Health Week. You can use your mobile phone to scan this code, and then you will be directly linked to the meeting, to the register form where you can receive a meeting link. Please remember to use the password, it's UFA. And if you would like to have more in-depth information about these different country visits, we are organizing a more general presentation of all the lessons learned, best practices and recommendations so far at the end of June this year. And if you would like to have more information on this, please feel free to contact the coordination team and we will provide you with more information on these events. I would like to thank Kara for the invitation to give you a short overview of the work that FIRA has been doing in terms of building more resilience of health information systems in Europe. I would like to thank you for your attention. Kara, over to you.
Thank you very much, Nienke. Many thanks for this comprehensive overview of FIRA's work in assessing national health information systems. And thank you for pointing out how important it is the need to harmonize and address inequalities in data collection, storage, validation between countries in order for us to really benefit together from better preparedness, more resilience through better information. And indeed, we hope that many of you listening in on this webinar today will also join us right after at 1 o'clock for the event that Nienke mentioned that will go into more detail discussing the FIRA country visits in that scope. And we, of course, look forward to then later on hearing about the key recommendations that will come out of these assessments and through which FIRA will hope to contribute to the better alignment, the better addressing of inequalities between countries when it comes to these issues of data collection, storage, and validation. So thank you very much for that, Nienke, and also thank you for giving us a bit of an outlook of where FIRA nests in this overall European context of health information systems and infrastructure, as you mentioned. And I think this brings us perfectly over as well to our next speakers. Nienke has already mentioned the extended mandate that ECDC has recently received and is in development in order to carry out work in this space. And I'm very, very happy today to welcome from side of ECDC Marie Hellery and Jonathan Suk, both from ECDC, the European Center for Disease Prevention and Control. Marie and Jonathan, thank you very, very much for joining us today. Marie, you have already been a guest of the Rapid Exchange Forum in the past, and Jonathan, thank you very much for joining us today for the first time. You're both preparedness experts, public health specialists, and you are both members of the unit and team within ECDC working on emergency preparedness response support. And as we already know, ECDC undertakes a huge body of work when it comes to preparedness and response support, and also now especially with this ongoing extension of your mandate in the scope of legislative work towards creating a truly resilient European Health Union. Of course, I can imagine this work has doubled and tripled. So we are really happy you're here today to tell us a bit more about it, to tell us a bit about lessons learned, about what is needed at this transitional phase of the current pandemic, and also finally how we can bolster our responses to future threats and potential upcoming new risks. So thank you very much, Marie. I believe you will be starting the presentation and sharing your screen, and Marie, the floor is yours.
Fantastic. Thank you very much for the introduction, Kara, and also thank you, Nienke, for the wonderful presentation. I'm just hoping that you are seeing my screen correctly.
Yes,
Good.
we can see it perfectly.
Thank you very much. So good afternoon, everyone. I think it's close to the afternoon now. My name is Marie Hellery, and today I will be presenting, along with my colleague Jonathan, a presentation titled Supporting Pan-European Preparedness and Planning for Future Challenges. So firstly, a brief outline of today's presentation. So we'll be going over the lessons learnt from the COVID-19 pandemic and how ECDC is transitioning out of the acute phase of the pandemic. And finally, what the future of preparedness and response looks like in Europe at the moment. So first of all, what is preparedness and how do we define it in the context of public health? So public health emergency preparedness involves a coordinated and continuous process of planning and implementation that relies on measuring performance and taking corrective action. And in outbreak events, also to respond in a timely, coordinated, and adequate manner. So preparedness is a continuous process. And it kind of operates within this anticipation, response, and recovery cycle. So at ECDC, this anticipation work revolves around mapping, assessing, and prioritizing risks and vulnerabilities, other activities like simulation exercises, capacity building, and in an outbreak or in a crisis situation, as exemplified here in the diagram, then we have the response, which is rapid risk assessments, other ad hoc technical guidance, field supports, and the stage where we currently are at is the recovery stage, which primarily consists of after action reviews, lessons learned exercises, and revision and amendments of plans. And of course, the recovery process here informs this preparedness and anticipation process, and the cycle continues. So the next steps in the recovery period from the COVID-19 pandemic. So the lessons learned work supports national and EU preparedness. It covers all phases of this preparedness cycle exemplified in the previous slide. So we've done this through after action reviews, which have consisted of developing protocols and supporting countries for training and workshops. We've put particular emphasis on critical areas such as long-term care facilities, schools, and evidence-based decision-making. And there are also various preparedness indicators and assessments that are in the process of being developed. And there are also simulation exercises, case studies, and targeted trainings for EU EEA member states. So part of assessing the effectiveness of response measures in the EU EEA has been done through the use of the ECDC JRC Joint Response Measure Database, which is a collection of non-pharmaceutical interventions. To this day, there are over 5,000 NPIs from over 30 countries that have been collected since January 2020. And the database captures measures at the local, regional, and national level, and it is updated every 2 weeks, therefore providing an up-to-date overview of measures in the EU. And this has been extremely valuable in assessing the effectiveness of NPIs and again informing this lesson learned. So here are the key lessons learned on shortcomings both at the EU and global levels. So shortcomings have been identified relating to health systems resilience, which is health systems' ability to transform, and this overall scalability of capacities and plans. Also, weaknesses have been identified at the interface between crisis management and public health preparedness. There has also been unclear decision-making processes, and sometimes bodies and governance of response have had unclear decision-making processes. So finally, we've also identified shortcomings at the risk and communication and community engagement sectors, and ways of addressing this both globally and at the EU level has been through the revision of the joint external evaluation tool, which took place over the course of 2021. There has also been a number of pilot missions in 2022 relating to the WHO Universal Health and Preparedness Review, and also the OECD European Observatory Health Systems Resilient projects. And the aim is to create a European health union for a more coordinated and structured union level approach to future health crises, with a number of legislative packages to be adopted in 2022, as previously mentioned by Cara. So another significant takeaway from these lessons learned exercises has been the importance of risk communication and community engagement. So we have identified the need to link behavior science results with policy and risk communication activities, as well as the need to develop capacity for behavioral studies and insights, and the capacity to implement these insights in emergency situations. We've also identified the need to develop and scale up capacity for community engagement and risk communication, as well as improve health literacy in the EU EEA countries. There's also a great need to increase qualitative research capacity as well as acceptance in the public, a need to coordinate mis- and disinformation management in EU EEA countries. And finally, there is a great need to create networks at the interface of scientific advice and policy making, which is key in a public health crisis. And here we can see a perspective paper by my colleague Jonathan and other ECDC colleagues introducing 3 key behavioral insights on the evolving COVID-19 pandemic. And on this note, I will now hand it over to my colleague Jonathan.
Thank you very much, Marie. So good afternoon to everybody, or morning, depending where you are, or even what time it is right now. I guess we're kind of on the border. As Marie mentioned, we have been working a lot in the past several months, and in fact, even on the very onset of the Omicron wave, to think about how we could get out of a sort of acute pandemic response and into more sustainable approaches to pandemic management, balancing the current risks with also the need to improve preparedness going forward. And so the work that we did through ECD was published as this perspective piece to the left there, but it also informed very heavily the European Commission's document that came out on the 27th of April on transition phases. In short, I mean, there's no way to say, you know, exactly when the pandemic is going to be over. We certainly see a declining severity, but not declining cases. We also are fully aware, of course, that at any time a new variant could come that would problematize things. So pivoting to the transition phase really is a decision, a risk management decision, to focus more on severe outcomes and to work on targeting vulnerable groups and improving vaccination coverage, you know, minimizing the burden of individual cases, while also enabling society to continue to remain open, as it is in much of the EU right now. And we can contrast that sort of societal choice versus no COVID strategies and how it would be to live in that setting. So this is a question of the tolerable residual risk. And for this, clearly, the information systems, the data that we have on the burden of disease, on the broader social impacts of the MPI measures that we've implemented during the pandemic are really quite important. And so that was mentioned earlier on lessons learned for information systems is really quite important. The better information that we have on the full scale of the burden of disease and the full magnitude of the risks and the health system impact of any disease is really quite important to then establish a commensurate level of response. Next slide, please. As others have already alluded to, we had worked for many, many years prior to the pandemic, promoting also the concept of One Health preparedness. We have meetings and topics on that. We've tried to develop One Health surveillance strategies for certain types of diseases, such as West Nile disease. We paid a lot of attention to climate change and what that would mean for certain types of infectious disease going forward. And this is clear that all of these different factors, like human demographic changes, population growth, and the quality of healthcare systems, conflicts and natural disasters, all of these are very relevant today, clearly. Environment, urbanization and deforestation, and travel and tourism, and animal practices. And we know very clearly there's countless examples. Next slide, please. Even prior to COVID-19, we're continually surprised by the scale of different types of outbreaks. So you all recall Zika and of course Ebola, particularly in West Africa, which really were quite major responses required to contain these, and in the end led to cases all over the world. The same thing with measles, with MERS, and then clearly COVID-19, which is a game changer. This is just, you know, monkeypox as mentioned earlier. It's amazing to see that prior to this year, these were the countries that had reported cases of monkeypox in the last 41 years. So 51 years. So all of a sudden, we have a massive outbreak. And again, it's just showing and telling that certain, long-term changes, for example, the gradual winding down of smallpox vaccination, plus demographic changes, plus whatever else is part of the story, we need to understand that better, suddenly lead to a really problematic and challenging outbreak at a time that none of us need this because we're still trying to recover from COVID-19. We still have lots of COVID-19 in many countries. We have a lot of other health issues as well that we have not paid as much attention to. AMR being high up on the list, tuberculosis and MDR-TB being another example. So this just demonstrates the continual need in improving preparedness response, and obviously the importance of learning lessons from individual crises like COVID-19, but also seeing what can be learned from these crises that are relevant to more all hazards preparedness and not simply to that individual disease. So we've tried to discuss a lot and think about it in the way that we're doing our work is that, we learn from the past crisis, but we have to prepare for the next one. And we can't assume that the next one will be similar to the last one. So we have to have some flexibility and to be on our toes. Next slide, please. Yes, yeah. So stepping back just briefly in terms of the future of preparedness and where do we go from here? I think it's instructive to first think about what was in place beforehand. We're going to see a lot of change in global health governance, maybe not as much as we would have hoped for, but we will see changes. In the EU, prior to the pandemic, we had a EU decision on serious cross-border threats to health, which is really instrumental for how our member states work with ECDC. And there's the EU Civil Protection Mechanism. At the moment, they're working to finalize and upgrade and strengthen the ECDC mandate. They're working to convert the decision into a regulation on serious cross-border health threats, and stronger legislation that should give us some more reach and should give also countries more clear instructions on what is required of them to improve health security in the EU. We have, as a technical agency, of course, all of the things that we've been talking about and the previous speakers as well. It's important to note that we're constantly doing early warning and epidemic intelligence. We constantly have a response function activated, and right now we're working on parallel responses with the hepatitis in children, with the monkeypox, with the COVID-19. And then we have all the usual tools that we need to do according to the diagrams mentioned, the after action routes, simulation exercises, risk ranking, country assessments. WHO, same thing. They're currently looking into ways to strengthen the mechanisms such as the joint external evaluations. They're also, and in the Euro region, working very closely with us to push after action reviews with European countries and CIMEXs. There will probably be changes one way or the other to the international health regulations. So it'll be interesting to follow that. There's discussion about a pandemic treaty. So there will be changes, and hopefully these are giving us further tools to strengthen health security. Next slide, please. One of the challenges and important things here, and I think also links very closely to some of the work of this group and the work of health information, is also measuring. And so it's one thing we need the information in the middle of these crises, as I mentioned before, on the burden of disease, on all of the sequelae, on the health impacts of a disease outbreak. But we also need to measure preparedness. And this has been a constant challenge. It was always been a challenge. The reporting under the static mechanisms like the international health regulations or decision 1082 in the EU lead to a list, but a country can report, or you can say we have this capability, we have this capacity, but how does it actually work during a crisis? It's really hard to measure. So we're looking now at revising the way that we do indicators, and again, this is dependent on the data that's available. Some combination of quantitative means-based indicators with result-based and performance-based indicators. So we're proposing also to include indicators for health system resilience and surge capacities, for example. At the same time, practically speaking, countries are busy. It's difficult if you're an EU member state and you must report not only to to the EU, but also to the WHO and to UN treaties. So we need to find ways to harmonize and simplify reporting at the same time. We do need indicators to be relevant to the EU context. I think in general, the feeling is that whatever is in place at the UN level, we should be able to have a higher standard in the EU, given the wealth of the countries that exist across the EU. And looking here, of course, as I mentioned earlier, at all hazard preparedness, we can't only focus on respiratory diseases, but we have to look at all different types of threats, as monkeypox has just shown us once again. Next slide, please. So an example of different ways we may measure this. For capacities, you have the regular things, and we need, this has been very, very clear that even these capacity-based static indicators in many countries have been really hard to get a firm grip on. And they're also challenging. If you look at ICU density or hospital beds, for example, there's no obvious way that you could assess, what that means. So it's not simply the number of beds, but how many qualified staff are there to take care of an actual ICU patient, an intubated patient in a hospital for COVID-19? How many specialized nurses? How many isolation facilities? So it's really complicated when you start to unpack each of these individual items. But there's a whole list of different things that we can do. Also looking at the laboratories, training, capacity building activities, national preparedness plans, and making sure that they've been updated in light of the COVID-19 pandemic. And dynamic response structures. Meanwhile, performance-based indicators to complement that. How often are SIMEXs and after-action reviews conducted? How is the surveillance system performing versus what it should be doing when you have a baseline level of disease that you would expect? What proportion is actually being reported and how timely? The scalability of alert levels, and so there's a lot of different things that we're looking into from indicator-based thing. And for this, health information systems will be really quite crucial. Next slide, please. Some of the other things going forward, of course, more operational. The pandemic, of course, exposed some shortcomings in the EU mechanisms for managing threats across the EU in a harmonized way. Right, we've seen countries adopt very different strategies and approaches, and some of this may be due to the epidemic situation in the country, but some of them are clearly also based on varying capabilities, varying societal norms, and so on. And so it's very hard to harmonize that. EU legislation does not allow for that, but we can at least try to have a better interoperability of planning and response measures. The lack of human deployment is something that has been addressed in the proposed mandate of ECDC and the proposed new legislation in the EU to establish a EU health task force. So this should help us to have a wider range of people who are ready to be deployed into field settings, either for response or for preparedness types of missions, to support EU and EEA countries, as well as, of course, potentially global countries linking up with WHO GORN. Main things here, again, in response during emergencies, rapid field deployment, outbreak investigations, field epidemiology, to run vaccine effectiveness studies, to provide technical tools or training as required, as well as targeted support over the longer term, reviewing preparedness, planning, conducting simulation exercises, working to support after and in-action reviews and general capacity building. So really trying to work in a more hands-on way in and with our partner countries and also with other global countries, both during and prior to emergencies. So hopefully, aside from strengthened legislation, better reporting and indicators, I mean, this is really where the work has to actually happen going forward. Again, with this vision of a continuous cycle, it's not one visit and you're done. No country's ever done. We're not done at ECDC either. It's just always trying to work to improve and optimize. And also, the world is continually getting faster, and so we have to be also much faster in how we work together across borders as well as across different sectors. Next slide. So I guess we covered a lot of ground. There's a lot of other activities at ECDC that may have been relevant as well. If it was our colleagues in surveillance or epidemic intelligence, you would have had a slightly different presentation, of course. SARS-CoV-2 is here to say it's yet another long-term challenge to public health and healthcare systems. the resilience of these has been really highly tested, and so it's great that there's work ongoing to focus on resilience, and more will need to be done for this. Part of the role here is advocacy for more resources, healthcare systems more generally, and part of it is being strategic with how we use these resources. We have to be prepared for a wide range of infectious disease risks. And right now there is the window of opportunity to learn lessons from the COVID-19 pandemic. And as Marie mentioned, we're trying all sorts of different ways to promote this learning. And it's not just enough to learn and to identify the gaps, but it has to be linked to action plans and concrete funding or policy streams that result from these lessons learned. So really need to be integrated in a high level within organizations. All of these amended global health governance frameworks, we will see how they shake out, but they will broaden the scope of possibilities for strengthened work and preparedness response in the coming years, and that's probably very important and a very good thing. And clearly we're very well aware, working across countries as part of our routine work, strengthen collaboration between countries and international organizations, and also between different parts of the world and different sectors. Is a continual challenge, but it's really quite essential for improving health security globally. With that, I think our presentation is over.
Thank you very much, Jonathan and Marie, for your presentation and for this comprehensive outlook on ECDC's work. And thank you, Jonathan, as well, for a very, I would say, powerful take-home message from that in the end, with all the planning that we are doing and that you are doing and that's going on nationally and on EU level. In the end, it is not enough to plan, but of course we need to look towards action from these plans. I thought that was a very nicely formulated message. And thank you very much, Marie, for giving us an outlook on the gaps in preparedness and response that have been identified, and especially also for the recommendations and the needs identified that can also serve for the countries to improve, and also this outlook on transitioning towards a more sustainable phase of pandemic management from the acute, let's say, firefighting phase we have all still been in for the last 2 years, which is, I think, of course, will be incredibly important as we move forward. And Jonathan, thank you very, very much also for bringing the One Health approach to preparedness into it. I think this dovetails very nicely also with the discussions that have been happening this week in the European Public Health Week, particularly on Wednesday, the day that was dedicated to climate and health. As you also mentioned, as you touched on, we've seen so many outbreaks recently with animal vectors, and also where an encroachment on natural habitats has played a role or may have played a role in these outbreaks. So thank you very much for bringing that aspect in and showing us that there's really a multifaceted approach needed to One Health, to climate and health when we talk about preparedness. And also thank you for mentioning the legislative processes underway. We all know there's a lot happening that might bring us forward in harmonizing not just European, but perhaps global responses, such as the outlook on the pandemic treaty discussions that's going on. And yeah, last not but least, thank you also for this outlook on new indicators, and perhaps which indicators, which flow of information might serve us best in the future to reduce reporting burdens, to really use the health information sources that exist to greatest effect. I have to say this is for us as the FireEye project something, of course, that we are tremendously interested in as a health information research and infrastructure project. And I know that some colleagues within the project, within FireEye, are also working with colleagues from your side at ECDC to build on these potential synergies, such as FireEye members validating certain information on particular indicators from FireEye countries. So we're very happy to be a part of that on that side, and look forward to continuing that collaboration. And yeah, thank you also for the great, if perhaps not entirely comforting, takeaway message that while we have to learn from past and current crises, we cannot assume that the next crisis, the next threat will be the same, and we have to really stay on our toes in that regard. And yeah, I might have a few follow-up questions still to you later in the discussion portion, and perhaps our attendees have as well. Please allow me to remind everyone to put questions into the chat if you have them, and also raise your hand later to come in. And thank you, Marie and Jonathan. I will move on at this point, but please stay with us if you can until the discussion as well, so we can follow up. And with that, I would like to introduce our next speaker. I'm very happy to introduce Maria Silva Paulo from one of our FiRi project partners. Maria works at Nova University in Lisbon, and her research is centered on health policies, health services, and development. And within the FiRi Rapid Exchange Forum, she and her team are also leading a task on the monitoring of COVID-19 policy and impact measures. So Maria, today I believe you will give us a bit of a look into the future as well in terms of discussing the role of foresighting, of modeling, as we transition out of the acute phase of COVID-19 and perhaps into a more sustainable phase of pandemic management, or being very optimistic and perhaps looking ahead already perhaps into a time when COVID might be classified as an endemic status. And I believe you have some insights for us as well of learnings and strategies in Portugal on the country level and also in the context of preparing for this upcoming winter season. So yeah, please, Maria, we are very happy to hear your insights and the floor is yours.
Dear Kara, thank you so much for this very nice presentation. I would like to start to say good morning to all of you. Thank you for joining us. Thank you all, Nienke, Marie, and Jonathan, for your presentations. And right now, I hope that I will be able to complement your presentations and to add some interesting content for our discussion. So I will start maybe from the end, but I will start giving you a very brief overview of what has been already discussed for Portugal and looking at the importance of winter in terms of this this pandemic, and this is the near future, and we are looking at it from the perspective of seasonality and why is winter so important. And as we see now, the situation with South Africa and the countries from the other hemisphere as they are going into it. And here I'm just showing you, can I see the next slide, please? Yeah, thank you. A rapid review that was performed, and then it was specifically looking at COVID and preparing winter. And this reports that despite there is a high successful vaccination campaign in the UK and also in Portugal and many other countries from Europe, the COVID-19 is here to stay, as we have just heard from colleagues, and we must not sustain all of our efforts that we've performed in the past 2 years. Therefore, we know that the health and the social care system are likely to face tricky challenges. It will be focused on the resurgence of respiratory infectious diseases each winter, including the influenza, COVID, respiratory syndrome virus, for example. There will be pressures resulting from the wider health and well-being impacts of the pandemic, including the impact of the delayed care seeking. And also, there will be continued disruptions from healthcare delivery if we continue to have further waves or even more outbreaks, as we are also looking at it right now. So to mitigate the impact of these challenges and to prepare for the winter period, as we are going to look again, this rapid review emphasizes that during the summer, and this is where we are entering, it should maximize the speed and the uptake of COVID vaccination programs, and try to give all the booster doses before the last quarter of the year. It should focus on the increase of the ability of people with COVID to self-isolate. Also, taking into consideration all the financial and social support that they might need. It should boost the capacity of the NHS, specifically for the UK, but we can think about the other health systems from Europe, building resilience against the future COVID and other outbreaks. And it should also provide a clear guidance about the environmental and behavioral precautions that individuals and the population must take. So yes, so this is the rapid review, what they pointed out, and it was from the Academy of Medical Sciences, and you can later on have a closer look at it as we have the reference at the end. So I would now like to ask for the next slide, please, Bartolome. And thank you. Focusing on Portugal, we have a very, very similar recommendation, which is that high rates of vaccination for the population, and that we should keep on monitoring the population health aspects, in special the most vulnerable ones that are considered, like in other countries, the chronic patients and people above 65 years old. Thank you. So yes, so in March 2022, so just 1 month and something ago, our National Institute of Health, Dr. Ricardo George, and our Ministry of Health, they have provided an analysis based on the mortality, the hospital admissions, and the vaccination rates towards the last 2 or 3 months. And it was possible to observe that in early 2022, Portugal had a mortality rate similar to other winters. There was a recognized the seasonality of the disease, and it was probably the winter of 2023 that where we will have high rates of COVID and some restrictions might come back, also due to the decrease of the protection from the vaccines. So again, the recommendation of having booster dose is timely up. Here in this graph, we can see the evolution of the mortality in Portugal due to all cases, and due to all cases will be the black line with the gray shaded area. And then we see that, yes, we had a peak in 2021, but towards here, the end, we can see that Portugal did quite very well during this last winter. So we should be planning and expecting the same for the next winter. Next slide, please. Okay, yes, very good. So passing this in brief introduction and a little bit of the Portuguese case and what we've been working on here from our ministries and national institutes, I will try to talk now about the COVID models and the forecasting and how forecasting and the models are so important to what we're doing right now and to the moment that we are living. The next, please. Here this graph, we all know it, I think, quite well at this time. And this was first released in March 2020 on Twitter, but it was already possible to kind of predict how the situation would evolve, the kind of waves that we would have from this virus, the SARS-CoV-2, especially because there was already similar ones like the MERS. And right now we have just added the hyperendemic, which is what we expect to be the end line of this very useful graph that came early on 2 years ago. Next one. Lots of news, and yes, 2 years ago we were having a boom of information, the infodemics, and we should now look at it and learn from our mistakes and try not to repeat the same errors that we did before. So at this time, and the COVID-19 has forced the public health professionals across the globe to reevaluate what it means to be prepared for, to respond to recover, and to mitigate the disaster response. And this is what we should look at. But Bill Gates has warned us early in 2015, and he said we are not ready for the next pandemic. I guess he was right. But right now, nowadays, after COVID, just a few months back, Frederick Christensen, who is the CEO of the Coalition for Epidemic Preparedness and Innovation, said that, in his opinion, of course, it is 100% certain that pandemics will be a part of the future. Then the uncertainties are just when, how how often and how severe they will be. So the next one, please. Yes, so we know for sure that this is not the last pandemic. We are facing climate change, and Kristen is not the only scientist. With a simple internet search, you will find many scientists from all over the world that have been warning about the threat that is posed by other viruses with climate change. And climate change is directly linked to a higher risk of pandemics, and it is rising temperatures, and it will enable mosquitoes, ticks, and other carrying insects to proliferate. So we can also expect lots of zoonoses, as we are again looking at it in this week. So now it is time to prepare for the next pandemic. And several events are been happening in the world. Webinars, as we are here today, summits, workshops, conferences all over the world. And here just two of them as an example. There was the Global Epidemic Preparedness Summit from the Corporation for Emergency Preparedness and Innovations that occurred last March. And there was also this preparedness in the area of COVID last April, and a few more to come. I just listed these two here for you, especially this event targeting the Global Pandemic Preparedness Summit was co-hosted in London and a lot funded by the UK government. And what they were discussing was the ambition to have safe, effective, and globally accessible vaccines against the next pandemic in the next 100 days. And this was following the G7. Yes, you can go to the next one. It was okay. Yeah. So to think about the crisis preparedness and the response, which is a complex process, that this is what all these summits are trying to look at, and to have some insights and key points. And we can see that the preparedness and the response system, they are an adaptive, complex system, and they are obviously correlated each other. So during a pandemic crisis, the professionals will work to mitigate the crisis, and they should know how to deal with the paradox. So they should be trained, and this is one key message that we would like to pass, meaning that they need to accept the several perspectives at the same time in a changing and rapidly evolving situation and reality. So they are organized as self-organized team and should be distributed in internal control with clear rules, action protocols properly validated and tested situations, and also to tackle open and to be open to innovation, as emergency is a complex phenomena and it should result from a non-linear interaction of many players. And it's very easy to see that, for example, at a hospital context or in health systems, information management centers. Next, please. This image tries to give you here the framework that was prepared from colleagues within the FARI, and thank you so much for letting me to use this image. So we will have scenarios to be able to model, to foresight, and to be prepared, and this is a transversal action in public health, but also to have preparedness, we need to be prepared. So this is also a complex cycle, and it's not disintegrated, although it is integrated. So the question is still, how can we predict the future, and which methods led by data can we use? So this is one of the questions that has been imposed by the global organizations, our countries, and the decision makers. Next one, please. At a time that information is constantly being published and changing, so in this graph, we would like to show you how much was published in PubMed, for example, thinking about the corona and the COVID, and so this is called the coronavirus cascade. And in the next slides, I will show you how a quick search, and this was in November 2021, how a quick search with these three themes and keywords: public health, COVID-19, and scenarios, was just hitting 20,100 results at PubMed without restrictions. So we can just, to give you an overview, if you go to the next slide, if we change scenarios to modeling, there would be 28,000. If we change it to the next one is foresight, there will be just 1,419. And if it is for preparedness, there will be 23,000. So at this situation as we were last year, there was a massive amount of information to be looked at, and how do we segregate it, these data, to be able to use it to have concrete answers is the key for preparedness and for modeling and forecasting. Next slide, please. So epidemic forecasting has granted increasing interest in the last decade. This was nurtured by various forecasting challenges that were organized in groups, especially it started more to be more prone in the United States of America, but led by ACDC, but also from other agencies like the Defense Advanced Research Projects Agency. And since 2009, flu forecasting is being done yearly, although now is when we and the entire world was faced with this term in a continuous base. So this recent study from Alamo and colleagues was published also last year, and it focused on the potential of data-driven schemes to address the different challenges raised by the pandemic. And as I was saying, in a time where tons of interesting information is being published from different multi-sources. So they come to bring an approach that is focused on monitoring, modeling, and managing the data itself, and they call the 3M approach, because data-driven tools are fundamental to monitor the spread of the epidemic and assess the potential impact of the adopted countermeasures, as the previous colleagues were just presenting, focusing, for example, on the MPIs that are impressive and very, very important to control the epidemics. Model and forecast the epidemic evolution, that's exactly what I was mentioning, and to manage the epidemic by making timely decisions to mitigate and to suppress the contagion, and to try to eradicate the virus if that's possible. But the next one, the next slide, yes, thank you very much. Here we present the roadmap that authors, Alamo and colleagues, they propose based on this 3M analysis, which explains based on a review of the consolidated theoretical methods, how does this effective past or current epidemics, namely the data science, epidemiology, and the control theory, can be used to preparedness. Thinking that our starting point is data sources and data itself. And this is because data is fundamental pillar to understand, to model, forecast, and to manage many of the aspects that are required for a comprehensive response against the epidemic and towards now the hyperendemic. And this is how we can have a better look at it to be able to have a decision making done here. Next one, please. So in the understanding of change, this 3M approach that comes from monitoring, look at the consolidated time series for the pandemic state estimation that is based on the database impact assessment that allow us to predict the models, to model their impact assessment later on, and to allow us to make decisions, is what can be used, and its importance is shown by the real-time surveillance of the epidemic, and also by the complement of the monitoring mobility using social media to assess the compliance to restrictions and recommendations. And this was a very key point of COVID that was not being so used before. Next one. Yes, so here we see how the design and the implementation of the surveillance system allow us to detect the sequent waves of the pandemic and how it shows us the effective economic interventions and public health response rates. Next one, please. Taking into account the preparedness and the logistics in crisis management, there is a need to evaluate the logistics resource and identify the key missing resources such as materials, transport, energy, to check the stocks of the equipment, to check on communication capacity, evaluate availability of water, electricity, and food support. For some response teams, this is crucial. It was crucial 2 years ago, and we should go back and have a look at it while we prepare for the next one. So all these aspects are related to security aspects and should be on the core of preparing for the next pandemic as well. Next slide, please. Sorry, I think this is repeated. Yes. Yes, thank you. So we need to understand and to analyze and to interpret the data so that they become useful information, and we need to understand the context of that information to turn it to intelligence. And this is what will drive decision makers. For this purpose, the WHO has created the hub to change pandemic and epidemic intelligence, and it will be the catalyst for creating this new approach. And I'm showing you the approach in the next slide, which has the core of better data, better analytics for better decisions. The core function of public health will be to generate these actionable insights for decision making, to protect and improve the health of the population, involving the continuous identifying, generating, connecting, synthesizing, analyzing, assessing, and interpreting this wide range of data, either if it is quantitative data or qualitative data, that will be relevant for the contextual information. And again, we look here at this new concept, which is called the epidemic intelligence, that will be able to guide us for what will happen next in the context of epidemic, but also in the context of new pandemics. And the base will be the indicator-based surveillance, but also the events which will come from an alignment of formal and non-official sources. So yes. Thank you. Very, very importantly, and I'm almost finishing, but this is not the least, is how to manage information properly, because frequent fragility in responding to crisis situations are due to a lack of information management, and we should avoid incomplete recording of double counting the cases. The information must be shared correctly in a timely manner and to allow one agile response. We should ensure that the data is secure, private, and protected, and also the ability to store information in order to allow free professionals in the field to perform some research, for example. Hyperendemic management also is a term that it will come for discussion, as endemics refers to a constant presence or an unusual prevalence of a disease or infectious agents in a population within a geographic area, and a hyperendemic refers to persistent high levels of the disease occurrence. The health systems needs to be organized to cope with hyperendemics. If information management is a key, and also skilled human resources are paramount to understand the main need challenges. So that's when we should focus on training right now. Yes, the next one. Thank you so much, Bartholomew, for helping me in this task. So as a key points that we hope will build up in the key points that our colleagues have presented will be to have a public health strategy and planning that include foresight and preparedness, to learn from the lessons learned that I think that we've heard a lot about it today as well, to focus on the human resources training, so healthcare workers capacity building, to focus on digital public health tools and infrastructure, and to have faster vaccine development and more equitable access for all. And I would like to say thank you very much for listening to our presentation, and we have our emails at the end if you would like to contact us.
Thank you very much for that presentation, Maria, and thank you particularly for, first of all, giving us the Portuguese example with your learnings and also strategies for the future, and also for reminding us how preparedness and response is such an adaptive and complex system. I think that was the really salient point in how we need to adapt our understanding of risk management of both pandemics and epidemics continuously right now, but also in the future, and also together with of course, newly formed actors in that space, including, for example, the WHO Epidemic Intelligence Hub. And thank you for giving us an overview of that landscape there as well, and an insight into the landscape of research that is out there at the moment when it comes to modeling, forecasting, etc. And what I thought was particularly interesting as well towards the end of your presentation, thank you for tying it back to this issue of managing information. This ties very nicely to what our previous speakers have said as well, the ECDC colleagues and Nienke. I think we can say this is running a bit like a golden thread through today and through the discussion today, this issue of information and data management, interoperability as an indispensable precondition for improving our preparedness and resilience, really. And yeah, last but not least, thanks for giving us this outlook on hyperendemic management and what might happen, what it may mean for strategies if COVID does in the future become classified as an endemic or hyperendemic, as it has been termed in this context. I think actually when we started planning this webinar, we were perhaps a little bit overly optimistic at this point already that we would really be able to talk about this transition is already further along or ongoing in terms of the classification or this shift from pandemic to endemic situation. But as also the WHO has pointed out recently, we are of course not there yet. And at the same time, we know from many other endemic diseases, including such as HIV, malaria, tuberculosis, that a shift to an endemic situation by no means means a shift to a worry-free situation, right? Endemic diseases still require very strong control programs to reduce infection, suffering, and death from these diseases, particularly, as you also mentioned, to protect the most vulnerable groups. So I think we have our work cut out for us, even should COVID become an endemic or hyperendemic disease in the future. And thank you for reminding us of that. And thank you for giving a bit of an outlook of what the strategies might look like when and if we get to that. So yeah, now with a little bit of delay, but I think it was really worth it because we had such interesting input from all of you. We can enter into the discussion, and I myself would have perhaps some follow-up questions to the colleagues, but of course I don't want to be the only one asking questions. So please, everyone in the room, if you would like to come and raise your hand. And I think Louis, you are raising your hand already, and I will oh yeah, please open your own mic. Perfect. And please let us know your question.
Thank you very much. It was a great day, good session. I have a question mainly to colleagues from ECDC. It was amazing, the presentation, very comprehensive. I did a report in 2016 about Ebola in Portuguese-speaking countries in Africa. And I identified then that one of the big problems was actually the lack of preparedness. All these were there already, and I'm sure you know this. So I think we didn't learn a lot, and I wonder if we are now able to learn from these 2 years and a half of COVID-19. But my main question is about the collaboration, European collaboration. One of the things I identified in the report regarding Ebola was the issue of resilience. How can countries collaborate and support each other when they need? What can we do regarding Europe? How can we, with these plans for preparedness, How can we prepare ourselves to be more prepared in Europe? How can we collaborate with each other? I would like to know your opinion a little bit deeper on this process of collaboration for this process. Thank you very much.
I mean, that's a really great question and point. Of course, the contexts are all very different, and I was in West Africa during the Ebola outbreak, and of course, the resilience or just there's a decimated health system to begin with, so it's a very hard point. And one of the questions that we had for a long time after Ebola is after every major outbreak that sort of sets the tone for discussion in the preparedness world. But we're always wondering how transferable is this really as a crisis? I mean, so there's a lot of focus on containment of high pathogenic diseases, and that's very specialized, but it's not necessarily fully comparable to what we had to deal with for COVID-19. And of course, the other thing was it really drew to light the importance of communities, resilient community engagement, and the need for public health anthropology, and that's equally relevant in the EU as in Africa. We've seen that with the vaccine acceptance issues and so on. But on the topic of coordination, yeah, I mean, what we would like to see is a better pooling of resources where possible. So there's already the EU, cross-border health directive, and we did see some examples during the pandemic of neighboring countries helping with capacity, with hospital beds, airlifting patients, providing mechanisms. So we'd like to ideally see a system where we can build upon those strengths. There's also the EU civil protection mechanism, which has also been used now in the crisis with Ukraine. So we just spent some time in Poland, for example, that's hosting 2 million plus Ukrainians who had to flee their country due to the war. And the civil protection mechanism can also be used where one country will request specific types of resources that can then be sent to another country. And that partially is, I guess, the role also of HERA, the establishment of HERA, to try to streamline in the case of medical countermeasures. But all these sorts of things, there are resources, and as you correctly allude to, I mean, the question is how we more optimally, not all countries need all of these resources at once. So trying to, on the one hand, increase the familiarity with these tools. We still have a lot of education to do on how the civil protection mechanism works and how it can be leveraged, for example, but also through the planning. We try to run also joint planning and joint simulation exercises, after action reviews also that go across borders, where international collaboration and coordination is one of the very key dimensions that we assess. We have maybe 10, 11 dimensions, and that's the top first one as really being essential. There's also, of course, the coordination of information sharing and all of that, but we think that works fairly well in the EU. There's always room for improvement, but it's really quite remarkable how much is shared through the secure systems, through the EWRS and EpiPulse between the different EU member states.
Thank you very much for that response, Jonathan. And I can see, Claudia, that your hand is up. I'll come to you in a moment. I would like to quickly also present a question that has been asked in the chat by Maya Romanovska, and it goes very much towards the issue of dissemination, communication with the public communication strategies, which is also something that we've been discussing in the REF forum recently. And I think perhaps a question that I will put to all of you in turn. It also goes towards what we were just discussing, Maria, about whether there is a chance of COVID becoming an endemic disease, or what would be the status if that happened, and also this facet, of course, that very much at the moment we're not yet seeing that trajectory. And Maya wrote, by looking at the situation we are at, we cannot and perhaps do not want to expect SARS-CoV-2 becoming endemic in the near future, if indeed at all. And she says, I wonder what steps we would need to take to build the awareness in the public once the official information that was sent to the public has been that the pandemic is over and that prevention measures are solely the responsibility of the individual anymore. And yeah, I think this is a very interesting question also. How do we communicate with the public, and especially how do we overcome this message messaging that perhaps, and also this fatigue of the public receiving information about the pandemic, and this messaging that perhaps it's all over now and it's only down to the individual to take preventative measures anymore, which is of course is quite detrimental to actually meeting the threat. So I wonder, Maria, if I could ask you whether you, from side of the Portuguese strategy or your experiences there on the side of communicating with the public and this sort of messaging, have any experiences, any best practices, or also obstacles you would like to share that you've seen?
I think this is a very, very interesting question. And I don't think that I can provide you with a concrete answer if that's what you're looking at, because exactly the way countries are communicating is also being different. So here in Portugal, it is still recommended to have some measures, and you should self-protect yourself. This is the message. But how people interpret this message, and one of the things that's, for example, if I might mention, we've been very interested in at task 8.5 is also to look at how people in behavioral human and the compliance can have a role in the managing and in using all the NPIs and how it will affect and impact the pandemic. More than that, I don't think that I can provide a clear answer. But I think that this is the case for discussion and for reflection for all governments and all entities, including, of course, us and here at the university.
Yeah, absolutely. Thank you very much for that. And indeed, as you mentioned, I think there's no clear-cut one and easy answer to that. But thanks for providing your insight. And I think that's a great point to just bring up for the discussion here. And perhaps also to the ECDC colleagues. I know that ECDC is also involved, obviously, in dissemination and communication efforts and strategies around that. Perhaps not both of you directly in the response and preparedness team, but I was wondering whether there's any outlook on that question you would maybe also want to share from that ECDC level, countering this fatigue of information, or perhaps also countering the harmful impression that the pandemic is over now and individual citizens do not need to contend with it anymore. So is there anything that you would like to share, Marie or Jonathan, from ECDC side on the question?
I mean, there's a lot to unpack with this question, of course, more than we have time to get into now. I mean, it's clear that risk communication has been a weakness in many countries. The oscillation between very strict measures and then the relaxation of measures has not been accompanied with very clear communication about what it might take to go up or go down in the level of measures that need to be implemented. The behavioral insights team and colleagues that we work quite closely with, have also noted that many countries do not have adequate behavioral insights capacity to conduct work during the pandemic, and that furthermore, obviously, this needs to be integrated into risk communication, so that these two disciplines need to be working very closely together. But effective risk communication really needs to begin with longer-term community engagement, building trust with populations, and leveraging behavioral insights work. It's more difficult with the question of the pandemic. I think it's still obviously a public health matter. It should not be left to individuals, to make their own decisions. It must be in the framework of a broader strategy that's sustainable. But that also means there might not be many measures in place, but that there's public health campaigning for vaccination, for masks in certain settings, in certain epidemiologic circumstances, just the way that there has been in public health for seatbelts or other things. So there is still a lot of public health work, but I think that the challenge that our decision makers face are clearly also balancing this. COVID-19 is one risk, but so are the mental health impacts of lockdowns or strict MPIs, or of delayed medical access for other issues. And so all of this needs to be balanced. In fact, we're having a large consultation on this exact topic in a few weeks to try to further explore that. But it is, of course, an incredibly complex area, and it also involves very much the politicians and political decision makers who set the tone for what types of decisions are possible.
Yeah, absolutely. Thank you for that answer and those insights, and for reminding us that in terms of the communicators, the decision makers, we're really facing a bit of a wicked problem here. It is more multifaceted than just communicating about the public health measures, the hygiene measures, etc., or vaccination campaigns, but as you said, also the risks to, or the detrimental effects to mental health, the knock-on effects of other aspects of the pandemic, of course, play into that as well. So it's really not just a simple task of communicating about measures or of communicating about the necessity to still adhere to certain public health guidelines. But yeah, thank you also for the insight, which I think is crucial, of the need to really connect here the behavioral sciences colleagues and aspects with the work in risk communication to improve the messaging, and for also reminding us that it's really a long-term process. We cannot just start by communicating or even communicating well, but there's trust to be built on several levels between decision makers, science colleagues, etc., and the general public. And that's really a process that it's much broader than just now the COVID-19 pandemic. So thank you very much for that. And I think we have another question still. I know we're going very slightly over time, but Claudia, if you would still want to ask your question just briefly, and perhaps we can get a very short input from the colleagues still.
Thank you, Cara. No, I was referring also to Maya's question or comment because I think most countries, I was just also parallel attending the IAMFI meeting of the International Public Health Institutions in Tallinn online, and they also discuss the scenarios that will be present in autumn, you know. So I know that there's some communication, or people would like to hear and understand that the pandemic is over, but I think we all experts are aware that this is not the case, and there will be other, let's say, situations like the monkeypox shows us. So it was a call for all of us to update our preparedness routines, our crisis control teams. But what we see, I think it's no longer the president of the republic, or in Italy, it was the prime minister who was leading the crisis control teams. And I think we see a difference here, that it's going back to the regular, or let's say routine responsible persons, usually in the ministries of health, in the medicines agencies, in the institutions that are in charge of epidemiologic surveillance and monitorings. So this is what I would see is the difference. But I think we still are all preparing well for autumn and winter. Thank you.
Thank you very much, Claudia, for that input and insight from Austria. And indeed, I think we're seeing a big shift of or at least in many countries, we are back into the hands of different communicators from necessarily the heads of state or the decision makers on the public health issues as we had at the start of the pandemic. And as you said, definitely big tasks remain ahead, but on the country level, we are also all working towards that preparation. And Jonathan and Marie, also thank you for bringing up the consultation that ECDC is about to have on this exact topic around the information flows and communication. We'll definitely all keep an eye out for that as well. And with that, I think we have to close the session, as I know there's many interesting following sessions happening, not least also by the FIRI network on the country examples. Thank you all so much for being part today of this interesting discussion. If you would like to stay informed on FIRI activities, please do follow FIRI on Twitter. Perhaps the colleagues, Bartholomew, can still post our Twitter handle again in the chat. I believe it's FIRI4EU. At FIRI4EU, if I'm not mistaken. And yeah, thank you so much. And thank you again very much, especially to the speakers, Maria, Marie, Jonathan, Nienke, or who already had to leave us for the next session, for making this a very interesting future-facing discussion. And I think we have a lot of room for discussions to build on this. Again, we didn't even get that much into current risks yet, like the monkeypox that have been mentioned here and there. And yeah, I think a lot of discussions remains to be had and work to be done. So thank you very, very much for being part of this today. Have a great afternoon and a great weekend after that. Thank you, everyone.
Thank you,
Bye-bye.
Karen.
Thank you very
Astrid,
much.
and thank you, colleagues.
Thank you.
Bye to all.